Each department of the medical faculty is unique by its works, discoveries and people who contribute to the development of Russian science. It's rather difficult to present here a complete review of numerous scientific directions developed by 45 departments of the faculty. So we'll only discuss the most important research achievements made by the investigators of the medical faculty. Since the foundation of the biochemistry department, its main scientific field has been tumor enzymology. Prestigious prizes and awards received for the years of work in this direction is the highest recognition of this area by the Russian scientific community. The original methods developed at this department are protected by 30 authors' certificates and 3 patents for invention. It is impossible to teach biochemistry without scientific investigations. Our research activity covers 4 scientific fields. We have several grants obtained from the Ministry of Education and Science. Our laboratories are modernized. We gradually equip our rooms. We have some links with the Russian Academy of Sciences, with the Russian Academy of Medical Sciences and Moscow State University. Together, we perform cooperative investigations. Professor Berezov's scientific school is well known all over the world. He pays particular attention to the problem of tumor growth. For several decades, Professor Berezov has been dealing with these questions, studying molecular basis of cancer cell proliferation. Long-term activity of the biochemistry department made it possible to create anti-tumor drugs of bacterial origin.
Поэтому опухолевая клетка наделена удивительной способностью бесконтрольного роста.
Tumor cells have a mysterious ability of uncontrolled growth. We wanted to find out whether it is possible to act on the enzymatic apparatus of a tumor cell so as to inhibit its growth. And we also carried out some experiments to obtain the enzymes in which there is a deficiency in a human organism. 3 enzymes produced by bacterial cells have been isolated at our department.
Это метионин гамма-лиаза, это глутаминоспарагиназа и, кроме того, это лизин-альфа-оксидаза.
It has been proved experimentally that these enzymes can affect malignant cells and inhibit their division. Today, these substances are undergoing preclinical trials. For the last 10 years, this scientific direction has been joined by several famous teams of researchers, including the Biochemistry Department of the Medical Faculty, Cancer Center and Microbiology Institute of the Russian Academy of Medical Sciences. There is also collaboration with some foreign colleagues. Professor Berezov delivers lectures with the results of the department research activity in the USA, Finland and Japan. The Department of Biochemistry and some biochemists from the land of the rising sun have got a joint patent on the production of enzymes for medical purpose. Active research work is carried out at the Department of Human Physiology too. This science studies vital activity of the entire organism and its single parts. The department team explores adaptation to the environment. All the investigations can be divided into 2 groups: physiological mechanisms of adaptation in animals and human beings. Nowadays, another new direction involving animal model of diabetes is being introduced at this department. Diabetes is a very serious problem for the whole world. The medicines used for its treatment are not always very effective, so we have to search for some new methods and means to normalize carbohydrate metabolism. It is suggested that hypoxia and hypothermia may have an effect on these processes. The main scientific field of the department is adaptation, and there is enough space here to develop it. Since People's Friendship University has an international composition, the research facilities are rich and diverse. Students from various countries perceive climate and living conditions differently, so every case is individual. In this small room behind the massive door, functional status of the organism is diagnosed. A big amount of information is hidden behind the seeming simplicity of just a computer, headphones and electrodes. Respiratory parameters and electrocardiogram are being registered. The main principle which was laid down into the basis of this method is mathematical analysis of cardiac rate. Variation pulsometry was used in the system called stress test. Variation pulsometry got accustomed at People's Friendship University of Russia. Moreover, this method is needed here more than at any other university. Students come from different countries. According to our observations, it takes them 3 years for adaptation. Generally speaking, this program was worked out for prognosis of cosmonauts' state before their orbital flights, but nowadays it's been introduced in clinical practice. Method of variation pulsometry was used in cosmic medicine in 1970s. Recommendations and works suggested by the professor of the Human Physiology Department, Nikolai Agadzhanyan, were successfully put into practice of cosmonauts training. Professor Agadzhanyan took active part in the preparation and medical provision of the first cosmic flights.
Проблема адаптации.
The problem of adaptation is a huge scientific direction which began to be developed by Professor Korobkov. Then it was continued by Professor Agadzhanyan. We are interested in this field in respect to the program called Students' Health. Students from many countries of the world study at our university. When they come, they find themselves in some new conditions, new time zones, they have to get used to a new diet, a new climate and so on. So their disease incidence depends on it to a large extent. The area of medicine, which studies vital functions of a sick organism, was introduced by the French doctor Jean-François Fresnel in 1542. He called it pathology. Having equipped with some up-to-date knowledge and instrument base, the lecturers working at the University Department of General Pathology and Pathological Physiology carry out unique investigations of the body's biological rhythms. They use a high-tech system of telemetry monitoring. Most of the human systems and even single cells have their own biological rhythms, which must all be synchronized with each other. If it doesn't happen, desynchronization occurs, which may lead to the development of some serious pathological states.
Благодаря неустанной работе в этом направлении мы занимаемся проблемами хронобиологии.
Thanks to the continuous activity in this direction for 40 years since 1970, our department has become one of the leading centers of chronobiological research in Russia. The Second Russian Congress of Chronobiology and Chronomedicine, which is a great event in the scientific life, is going to be held at People's Friendship University of Russia. It shows how much our investigations in this field are appreciated.
Ценит научная общественность наши исследования в этом отношении.
The Laboratory of Functional Research Methods, Chronobiology and Chronocardiology was equipped in 2007 in the frame of the innovative educational program. The experiment on rats with genetic hypertension began in 2009.
Животному имплантируется специальный такой вот датчик.
A special sensor is implanted into an animal body and continuously monitors a certain set of functional indices, such as blood pressure, body temperature, motion activity, and electrocardiogram. This sensor uninterruptedly converts them to a radio signal, which is transmitted to the special receiving device in remote wireless mode. Then the data is continuously registered in the computer memory.
Также в непрерывном режиме в памяти компьютера.
Thanks to the new technologies, data logging can be performed round the clock for many months running. There are no other laboratories like these, either in Russia or even in the countries of the former USSR. Associate professor of this department, Mikhail Blagonravov, took a special trip to Germany so as to master the method of sensor implantation. Surgical operation is performed under general anesthetic. It lasts about 2 hours and requires high precision. Virtually all the departments of the medical faculty realize their research projects. Medicine, biology, chemistry and physics make up a fortunate integration which sometimes results in unique discoveries. Young scientists carry out fundamental investigations using modern molecular biological, biochemical and immunohistochemical methods. According to Associate Professor of the Department of Biology and General Genetics Madina Azova, preclinical and clinical trials of medications can be performed on the available instrument base. In the frame of the federal target program called Academic and Teaching Staff of Innovative Russia, the Department of Biology and General Genetics and the Department of General Pathology and Pathological Physiology carry out experiments on programmed death of myocardial cells in acquired and genetic hypertension. We investigate cardiac cell condition, activity of some certain enzymes responsible for cardiac cell death. And the second stage of our work, which we have already begun, concerns the effect of some medicines on myocardial cell death. Cardiac cell death is one of the mechanisms which contributes to the development of chronic heart insufficiency in case of hypertension, and this is an important problem of modern public health.
Одна из больших проблем современного здравоохранения.
Women's health is the priority area of modern public health service. Investigations performed both in Russia and in the world involve analysis of different etiological factors inducing disorders of the reproductive function and methods for its recovery. In cooperation with numerous Moscow clinics, the Department of Obstetrics and Gynecology, with the course of perinatology, realizes its scientific potential very actively. The department, headed by Professor Rodinsky, does not only retain the previous scientific achievements, but it also develops some little studied directions in the field of obstetrics and gynecology. This science permanently equips itself with all the newest achievements of medical practice. This department also pays great attention to the problem of safe maternity. Professor Rodinsky gives reports on this subject at Russian and international congresses. Many contradictory theories, hypotheses and suggestions on obstetric management have recently been advanced. The main task for practical doctors is to estimate the effectiveness of these methods, which may do either good or harm to the mother and fetus, and may also have an effect on the baby's future health. Human beings obtain over 80% of information through the eyes. Scientific activity of the ophthalmology department set itself as an object to save each percent so that the image remains sharp. The teaching staff of the department, working at 12 clinical hospitals, practice the main scientific achievements every day, providing prophylactic and surgical treatment of progressive myopia, anomalous clinical refraction, surgical treatment of glaucoma and cataract, including their complicated forms. In this field, there are several methods of minimally invasive surgical treatment which have been developed at the department. Some modern equipment is used for these operations. Incision length, which enables to eliminate cataract, is just 2.2 mm. This is so-called gold standard. The department has another very important direction – conservative and surgical treatment of retina disorders. Among the special surgical methods, we could mark out revascularization of the retina. In order to improve nutrition of ocular posterior section, blood supply is supplemented at the expense of the external carotid artery and implantation of donor tissue. This method knows no equal in the world. Such operations are not performed anywhere else. In the frame of the priority national project Education, the laboratory called Innovative Methods of Treatment of Ocular Pathology was founded at the Department of Ophthalmology. It is equipped with the newest ophthalmological instrument base. For today, laser treatment of ocular pathology is one of the most progressive methods used at this department. Some collaborative projects with the Institute of General Physics are also carried out. Any tissues can be punched out with this laser, and damage to tissues surrounding the canals that the laser makes is very little. This method makes it possible to perform fistulizing operations without any severe damage to the visual organ in this case. We consider this operation to be very perspective, and we haven't seen any attempts to carry out such operations at the same level in literature.
Попыток выполнить такие же операции вот на таком уровне.
Features of ocular prosthetics, problems of ophthalmogerontology, first aid in some urgent ophthalmological states, ocular disorders in tropic countries are included in the area of scientific interest at this department. 17 residents and 9 postgraduates take part in the research activities at the Department of Ophthalmology. Among the departments situated at 64 City Hospital, there is also the Department of Faculty Surgery. Since its foundation, it has been dealing with disorders of the pancreas, gallbladder and bile ducts.
И это наше главное направление. То есть мы выполняем и малоинвазивные
This is our main field. We perform minimally invasive operations on the gallbladder, bile ducts, methods of radio and biliary intervention involving surgical approach to the ducts through the duodenum in case of all the existing lesions, both malignant and benign. We also deal with pancreatic disorders, including oncology and chronic pancreatitis, which nowadays occurs much more frequently than before. Thereupon, we have to perform operations more often, Professor Klimov continues, and now we use some up-to-date equipment, our knowledge and skills in pancreatic disorders treatment. Scientific activity of the department also involves development of new diagnostic methods in hepatic disturbances and analysis of the reasons and sources of gastrointestinal hemorrhage. Surgical operations of this kind are usually carried out at big scientific centers. The newest instrument base of the department includes an ultrasonic apparatus, a computer tomograph, an MR imager, which enable to perform diagnostic examination with high accuracy. Multi-field Moscow hospitals have become clinical bases for the Department of Traumatology and Orthopedics. The works of this department are well known all over the world. The professors working at this department have undergone training courses in some leading clinics of Germany, the USA, Britain, Denmark, Spain, France and Switzerland. Scientific achievements of the department workers are really revolutionary.
Одно из направлений – это эндопротезирование сустава. Наши отечественные изделия, в разработке которых принимало участие кафедра наша, сотрудники кафедры.
One of our scientific fields is replacement arthroplasty. Research workers of our department participated in its development. This is a system of primary oncological revision arthroplasty of the hip and knee joints. We may call ourselves leaders in this direction in our country. We were the first to create this knee joint in our country. There were no joints of this sort before. It has shown good results. To some extent, we are pioneers in this field.
Он себя зарекомендовал. Так что мы как бы являемся в какой-то степени пионерами этого направления.
The department workers may be called pioneers in many scientific fields, including methods of osteosynthesis, that is treatment of tubular bone fractures. If just several years ago this operation lasted about 2 hours, today it only takes 25 minutes. Much progress has been made in the sphere of spinal column pathology. The method of minimal surgical approach to the lumbar spine from 3 to 5 centimeters long was elaborated at this department. And one of the department professors, Alexander Loko, has invented an anticorrector, a special device which enables to diminish deformation of the spinal column. The plate of this anticorrector does not prevent patient's growth, which is the main advantage of this construction. The world medical community got interested in this Russian invention, and it's already been produced in Germany. And now, 2 London universities are testing this product so as to introduce it at their clinics.
Они действительно мастера в деле имплантации.
They are real masters of replacement arthroplasty. By the way, I'm one of their patients. After I had been operated on, my life quality became quite different. Actually, there are people who bring great relief to patients. So long as many students of People's Friendship University come from various countries of tropical and subtropical zones of the Earth, tropical medicine has remained an actual subject for the research work at the medical faculty.
Целый ряд заболеваний, которые раньше были характерны только для стран.
A whole number of diseases, which were earlier typical for only tropical and subtropical countries, has come to us. We had, we now have, and unfortunately will have, imported malaria, let alone some gastrointestinal viral disturbances and other diseases. We assign some special means from the faculty non-budget for the investigations in this field. Professor of the University Department of Infectious Diseases with the course of Epidemiology Anatoly Tokmalayev carries out investigations aimed at development of diagnostics and treatment of infectious and parasitic diseases, including malaria and helminthic invasions. The professor also realizes clinical and consultative work at the department clinical basis at 1 and 2 infectious diseases hospitals. Problems of tropical medicine have been studied at our department since 1965. We have always worked in close cooperation with the Institute of Medical Parasitology and Tropical Medicine. We have a lot of cooperative works. Patients in a comatose state with multiple organ failure are taken to our hospital. It's a very serious situation, but a very good team of resuscitation specialists has been formed at our hospital. These specialists permanently upgrade their skills and learn all the new. In the latest case, 2 patients with coma survived because some new methods of pathogenetic therapy were used. And for our part, we did our best to provide etiotropic treatment with some up-to-date medicines. Now these patients only need rehabilitation. Professors and postgraduates working at the Department of Microbiology and Virology and at the Department of Infectious Diseases underwent training courses in Mexico, Chile and Cuba. The main scientific directions on tropic medicine involve malaria and trypanosomiasis. The main target of the department workers is to help developing countries where parasitic diseases exist and develop. More than 1 million people die of malaria every year. For the years of infectious diseases study, an absolutely new method of malaria treatment with high-frequency current has been created. You put your arm into a special oven for 2 or 3 minutes of heating if you are ill with malaria. Next day you come again and repeat the procedure, and malarial plasmodia, typical for this region, are killed. So at the finish line, after 7 or 8 treatment sessions, a patient is healthy and there is no need in any medicines, and the problem of drug resistance does not arise.
И не надо никаких лекарств, никакой проблемы лекарственной устойчивости плазмодий к малярии.
Many graduates of the faculty work at some universities of Chile under the contract and study the problem on site, as they say. Native citizen of Chile, Yuri Salinas, who is a postgraduate of the Microbiology and Virology department, is writing a dissertation on the following subject: non-invasive diagnostics of Helicobacter infection and its treatment in patients with trypanosomiasis. Helicobacter pylori contaminates different areas of the stomach and duodenum. It is the microorganism that most commonly becomes the cause of stomach and duodenal ulcer and gastritis. Modern equipment, a gas analyzer of the expired air, enables to detect Helicobacter presence in the organism. The method is very simple. A patient drinks some solution of urea and respires into a tube for 15 minutes. Bacterium can be revealed in the expired air. Another respiratory test measures hydrogen concentration in the bowels.
Это очень важный прибор, очень интересный, потому что позволяет понимать здесь.
The device is very interesting because it enables to test contamination of the bowels. Human cells do not produce hydrogen. but bacterial cells do produce it.
Понимать концентрацию водорода, то, что в принципе в клетке человека не образуется, образуется в клетке бактерий.
Associate Professor of the Microbiology and Virology Department Елена Васильева adds to what her postgraduate has said. Apart from non-invasiveness, which attracts patients so much and which is one of its indisputable advantages, the device can also reveal malignant neoplasms in the gastrointestinal tract at an early stage.
Мы получили большие средства.
Taking part in the innovative educational program, we obtained big funds. The university got about $25 million. The medical faculty got over $4.3 million. There hadn't been such a great finance aid to the faculty science and education before. And we purchased some up-to-date equipment, which enables us to solve questions at a high methodological level.